Now, today we will be talking about, I'll be giving you some tips about the how to get a good endometrial flow. How would I get a good endometrial flow? It's important for me because if I'm treating a patient of infertility, I would like to know whether the flow is good or not. But many times when I try and the flow does not come, although everything looks fine, but still I'm not able to see the flow. So there can be many reasons behind it. So how to get a good endometrial flow, or rather I would not say a good, because it will depend whether the patient's endometrial flow is actually good or not, but how we can get the best assessment and what are the things that we should do to get a proper endometrial flow. So the first thing that you should remember is that whenever you are seeing the endometrial flow, remember one thing, that endometrial vessels, they are very small. So when they're very small, what's going to happen? The blood flow would be very slow, so the velocities would be low, and as a result you may not be able to pick them up that easily. So the first thing that you have to do is reduce the velocity scale, or the PRF, or the velocity range, whatever your machine says. Some machines say PRF, some say velocity range, some say scale. So reduce that. Don't keep the velocity range or PRF more than 5-6 centimeters. No, just keep it below. Now, what would be the problem sometimes you will face when you will keep the velocity range low? The problem that you will face may be that artifacts may come, color artifacts may come. So then what can you do if you have reduced the velocity range to the minimum possible and you are seeing color artifacts? What can you do? You can switch over to power Doppler. Most of the color Doppler machines have the option for power Doppler. Power Doppler can pick up the slow flow without giving you the artifacts. So this is the first point. Second point. Now, another problem that with endometrial vessels is that you cannot see them on grayscale. So you don't know whether your vessel is oriented properly to the beam or not, whether it is at 90 degrees or the Doppler angle is fine or not. So sometimes the flow may not be seen. Then in those cases, what you can do? You can what can you do now, because you cannot see them physically as such on grayscale. So what you can do, just move the probe. Once you've focused the endometrium, you put the velocity range to a proper scale. Now just move the probe very slowly, very slowly. Keep changing the direction of the probe, but remember, rotating, slowly, slowly, slowly rotate here and there. But remember one thing, your motion should be slow. Otherwise, also for Doppler, always remember, move your probe slowly. Why? Because if you move very fast, then what is going to happen? These kind of motion artifacts will come. Now you can see these are not vessel areas. So some motion artifacts may come, color artifacts, because of the movement of the probe, they may come. As a result, you may have a false interpretation. Sometimes you may think that yes, there is good flow in the endometrium, when actually it may not be flow, it may be just color artifact. So move the probe slowly and then gradually have patience, wait for some time, you will be able to see the small vessels. Now, the second thing that may come to your mind, like I just now said, that whether this is flow or this is just artifact or what we call as noise, then how will I know that whether this is flow or artifact? So for that, what you can do, you can use spectral Doppler. For example, let us assume that this area I feel is not color, but it is artifact or noise. So what I can do, I can put spectrum over it. Put spectrum over that area. No, the pulse wave. I mean to say not spectrum, pulse wave over that area, the spectral flow. For the spectral flow, put pulse wave over that area. And if it is a vessel, it is going to show you a particular pattern, an arterial pattern or pulsatile pattern. But if you just look at the picture here, what it is showing you, just haphazard areas are there, haphazard area, what we call as noise. It does not have a specific wave pattern. It is just haphazard, irregular areas, some here, some here, some here. So this is telling you this is noise, and this is not an actual flow area. This is not blood flow, but just an artifact, right? So this is how you can differentiate it, whether this is color flow or this is artifact. This would help you otherwise also in Doppler, anywhere you are facing color artifacts. So keep this in mind whenever you are going to look for endometrial flow. What are the 3 points that you should keep in mind? First, keep the velocity range as minimum as possible. Second, if you are reducing the velocity range too much and you're getting color artifacts and you're still not getting proper color, then you can switch on to power Doppler. Then another point, whenever you are moving the probe, move it slowly so that motion artifacts don't come. And another important thing is, yes, you will have to move the probe, because in one position of the probe, the color may not be seen because the Doppler angle may not be proper. Maybe the vessel is at a perpendicular angle and you may not be able to see it properly. So move the probe, keep on moving it very slow, so that you can get the vessels at proper angles and you can see the color flow. Third, obviously, for all these things, you have to be very patient. And fourth, don't confuse the artifacts with actual or real color flow. Right? Actual color flow, when you will put pulse wave Doppler, it will show you a particular spectrum pattern. It will show you an arterial wave pattern. While if it is just artifact or noise, it will just give you the haphazard irregular wave-like areas which will have no particular pattern, and you can come to know that this is noise. Fine. So these all the points can help you when you are doing endometrial flow. Obviously, it has to be done transvaginally. Abdominally, you would not get very good things, very good pictures as such. So you have to do it transvaginally, and this way you can assess whether the endometrial flow is reaching till what zone, 1, 2, 3, or 4. And I'm not going to go into the details of zone because that is a separate topic altogether. So we are just going to talk, I'm just telling you how to get a good proper flow so that you don't make a mistake while assessing the endometrial flow. I hope these tips would be helpful for you. Thank you.